Good morning, everyone, and welcome to the very highly rated, critically acclaimed Health Committee meeting for Wednesday, September 13th, 2023. It is the appointed hour. I am calling the meeting to order. As we gather this morning, I wish to acknowledge, on behalf of committee and our community, that we are meeting on traditional territory of the Algonquin Nation. We thank the Algonquin people and express our respect and support for their rich history. We are extremely grateful for their many and continuing displays of friendship. We also thank all of the generations of people who have been careful stewards of this land for millennia. Very pleased to see Ms. Chaput back in the room this morning, so welcome here with us, and I would inquire if the roll has been called, please.
The roll has been called and we have quorum.
We have quorum, thank you. Next item is disclosure of pecuniary interest, and if there is any, the general nature thereof, please. I see none. I'd now seek a motion to adopt the minutes of our previous meeting held on August 16th, 2023. Moved by Councillor Weir, seconded by Councillor Grills. Any errors or omissions? I see none. All in favor? That is carried. Thank you. We do have a delegation, an internal delegation this morning. I'm very pleased to welcome Chief Nolan to the podium, who is going to be providing a delegation regarding the creation of a mental health addictions and homelessness hub that aligns with strategic directions for community wellness and healthcare and attainable housing and infrastructure. The floor, Chief Nolan, is yours.
Great. Thank you, Mr. Chair, and through you to members of the committee. Thanks for entertaining a delegation by myself and Ms. Lapine in fulfillment of, in part, our responsibilities under the strategic plan number 3 in terms of community wellness. And I think that it's probably no surprise to anyone in this room that issues related to mental health addictions and homelessness are front of mind for all of us in the community. And I'd like to start by acknowledging Councillor Lafreniere and thanking her for her continued reminder of the importance of this issue in our community, and that really it's almost impossible to do enough, but we have a responsibility both socially and organizationally to do as much as we can. So with that, the CAO, Craig Kelly, brought forward an innovative idea, to be able to move forward both on our strategic plan, but also in a very practical, boots on the ground kind of way in supporting our community and some of our most vulnerable population in this community. I'd also like to acknowledge the warden and his expertise in this area. I've been a crisis worker for many, many years, and his support of not only community paramedicine and community services, but also the county's role in supporting this across our communities. So I'm going to start with the end for you. And so you'll see a slide very similar to this at the end. So we'll click one forward. And really it's about the goals. So why am I up here and what is the goal of the conversation? But probably more importantly, what is the goal of the innovative idea brought forward by Mr. Kelly so that we can create an innovative model of care, a partnership with our friends in community services, but also the broader health, community, and social services sector to ensure that all people have access to a full range of quality health services that they need when and where they need them without financial hardship. And I think the where is critically important. Certainly in paramedic services, we bring care to you, as do the services of our friends in community services. And we're going to hear a little bit more about that when Laura comes up to speak about it. That this model of care will connect clients with care to ensure the full continuum of essential health services, from health promotion, prevention, treatment, rehabilitation, palliative care, are all available to them. And I think it's important that many of these services already exist in the community, and no different than community paramedicine or VTAC. We very deliberately spend time connecting people with the experts that already exist. We have hospital partners, primary care partners, the Ontario Health teams and their rise in terms of bringing together organizations to be able to address issues such as mental health, addictions, homelessness, but also broader issues related to primary care, much like VTAC plays an important role in that. Leveraging existing services, as I've listed here, and obviously public health is a big part of this conversation as well. But without getting ahead of ourselves and engaging with them, our goal is to have a conversation with you today and then seek some direction as to where we go with these concepts so that we can, once we have clear direction from these chambers, then we can engage with our partners external to this organization. So that's why Laura and I and Jennifer Dombrowski and her team have started the conversation about what could this look like. That it aligns with the County of Renfrew Community Wellness and Healthcare Strategic Goal number 3 in supporting sustainable programs and funding for VTAC, for community paramedicine and mental health, and that's directly out of your strategic plan. That the proposed model of care expands community-based seniors health services and ensures all residents have access to primary care support, particularly in the areas of mental health, addictions, and homelessness. And that it improves access to care and services while decreasing the incidence of mental health addictions and homelessness-related crises, and its use of 911 and emergency departments around the county. And that's a common theme with community paramedicine. And much of the work that Laura and Jennifer's homelessness team is already doing is quietly supporting a reduction in 911 calls and the use of the emergency department by preventing crises from occurring. And then lastly, looking at our partners and allied agencies and OHTs and how do we optimize their expertise and available resources to provide these services necessary to support these populations. But as I said earlier, once we have direction, then we will engage external organizations as to the finer points of how this could look for you. So a little bit of background on the mental health addictions and substance abuse side. We know that people experiencing mental health addictions and substance use are significantly increasing and that they require additional support across Renfrew County. I don't think that that's a surprise to any of us. But that Ottawa West Four Rivers, OHT, has identified that 35% of emergency department visits were related to mental health and addictions, often overwhelming their emergency departments as the first point of contact for care. There's a 75% increase in opioid-related deaths in 2021, revealing the severity of this crisis, and that hospitals are facing emergency department closures and staff shortages, and unfortunately that has become common, and that urgent action is needed to divert the strain of 911 paramedics and emergency department flow to stabilize the system, preventing further deterioration. So there is a need, both from a county and a paramedic service perspective, and leaning into this, that we do have a place and a seat as part of the conversation, and there are other innovative models in Eastern Ontario and around the world that have leaned into these populations. Many of them are large urban centers who have had mental health and homelessness issues brought to the forefront in the past decade, but certainly the pandemic itself has brought many of these issues to light in other communities such as our own. So mental health and addictions conditions are affected as well by homelessness. So people living with mental health and addiction conditions are disproportionately affected by homelessness, and Laura's going to talk to you about that. Improving the social crisis will require new ways of helping the critically vulnerable population. The consequences of homelessness tend to be more severe when coupled with mental health conditions. So there is a relationship between homelessness, mental health, and addictions. And then lastly, people with a lived experience of mental health and addictions conditions remain homeless longer and have less contact with family and friends. So with that, I'm going to invite the experts from community services to come up and share their perspective based upon the work that they've been doing about what's going on around us and how this innovative solution can work towards assisting this population. Laura.
Welcome, Ms. Lapine.
Thank you, and good morning. So, housing and homelessness, this is something that we in the Community Services Department is very familiar with. And it's something that we've been working on for many, many years. And as many of you have seen, and certainly as Chief Nolan has identified, we've seen an increase in the homelessness in our county, across the province, across the country, and what I'm hearing on the news around the world. It's not one location, it's everywhere. But we're certainly feeling the impacts here. And we do different things in our Community Services Department to help get a real sense as to what that looks like in our community. Now, we work on the ground, boots on the ground every day, and we are hearing from all of our partners where things are happening and what's going on. We also have people who intersect with different agencies that identify as homeless. And then we also have heard that there are many people who are homeless that will not identify with any agency. So for us, through the County of Renfrew, we complete what's called a point-in-time homelessness count every year. This is mandated by the Ministry of Municipal Affairs and Housing. It is something that we do every year to get kind of a thermometer test on, what is this picture looking like. This is a very different kind of approach in that it is, we work with all of our community agencies, and we kind of pick a date and we ask that, let's really investigate and see what is homelessness looking like on this particular day, and then we roll up that data. So our last one was done in September of last year, and we do a survey. Again, people have the right to remain anonymous during this information, and we acknowledge right up front that not everybody is captured in this, because there is no way we can capture everybody. But these people that we do capture are people that have intersected with agencies and have agreed to participate. So you'll see on the screen that we have 53% have identified physical limitations in terms of their homelessness. Medical conditions, 44%. Mental health conditions, 40%. Substance abuse, 33%, and cognitive limitations, 90%. So that's a significant amount of information that we gather from people who are willing to share that information. The County of Renfrew completes ongoing homelessness enumeration also. So it's another activity we do through the Built for Zero Canada initiative. And we are partners with that initiative. We entered into a memorandum of understanding with them. And this is a very different kind of capturing. This is where we really look at people who are experiencing homelessness that is considered chronic. So they're homeless for at least 6 months or more, and we track them very closely. And you can see for a period from April to August of this year, 58 people identified as experiencing homelessness, and 28 were chronic. These are people who are part of our program. We know, and it'll be identified here, that there are many, many more than that. So our program, our county's homelessness prevention program, provides coordination and funding for things like hotel stays for anybody experiencing homelessness. Now, these are more acute situations. This is not going to be a long-term program, because the funding that we receive from the province, which is the only homelessness funding we get, is through the province of Ontario. And we have a limited amount of money that has to cover a wide range of programs. And one of the programs that we have is helping people into temporary accommodation for 1 or 2 nights, just stabilize them, get them in under a roof. So we utilize our local motels and hotels, and then we engage with these folks to try to get them connected to other services. It's a long journey. But to give you an idea, we had 199 hotel stays from April to August of this year alone. So 2 pieces to consider here. This is a large number of people, and many of these people are counted in some of the other numbers that we referred to. But this is also an incredibly expensive approach, because hotels are not inexpensive. They're temporary solutions, and sometimes somebody will utilize a hotel for 1 or 2 nights, and get connected to services and maybe have some temporary situation, or get connected but find themselves destabilized or unhoused once again. So they may, the same people may be reflected in these 199 hotel stays. But as I mentioned earlier, not everybody connects with or intersects with community services. We anticipate that the numbers that we identify is at least 40% higher. We know this because we have many partner agencies. Some people will never come through our doors because they're working with another partner agencies. We have many faith-based groups that are supporting people who are homeless, who those folks may not want to enter services. Or we have people that are living what's called rough, who feel that's okay. but still fall under the homelessness category. And they only intersect with a service when the conditions become so severe, such as minus 35 degrees or plus 35 degrees. That's when we often see people showing up again. We know that homelessness is a very big issue. And through our Ontario Works program, we see a number of people entering for financial assistance. We also know a couple of other things through that, which is the Ontario Works Financial Assistance Program has had no financial increase in many, many years. Now, you may have heard that the Ontario Disability Support Program had a 5% benefit increase. Ontario Works did not get that. We do not have one person on Ontario Works in the county of Renfrew, save for except the few that are in rent-guaranteed income housing, that their payment from Ontario Works, which consists of a basic needs, food and other things, and shelter, we have nobody whose shelter costs are being met in the county of Renfrew, which means they're dipping into food money, which means they're dipping into other funds. So those folks are also always at risk of homelessness, and our staff spend a lot of time in our homelessness prevention program and through our Ontario Works trying to keep people housed, and sometimes it's a very thin wire. Maybe I'll stop at this point and hand the podium back to Chief Nolan. Thank you very much, Chair. Thank you.
Thank you so much, Ms. Lepine. Chief Nolan.
Tina, if you don't mind. Thank you. And thank you, Laura, for enlightening that. And I think I'm really pleased that we're having this conversation today, because we often don't pull back the curtain on these types of issues at a level that is transformational, let alone transactional. So I think that expertise that Laura's department has and the work that they've been doing for a very long time makes a significant contribution to this population, but there may be other ways that we can continue to work together on this. So what does this look like? And many of you are probably familiar with the Ontario Rurality Index, and often we compare ourselves to large urban areas. But when you think about it in terms of the rurality confounders, the things that make us special, for good or for bad, in rural Ontario, one of the data points that really jumped out to me was that the proportion of individuals with mental health and addictions concerns that reside in rural areas in the Ottawa Valley OHT are 13 times higher compared to the Ontario-based Rurality Index scores. So we know that we have a number of different challenges, and we could spend a lot of time figuring out why and where they come from, and how that statistic is true and fact and provided to us from the OVOHT. But when we look at the Ottawa Valley OHT, 1 in 5 individuals have mental health and addictions concerns. 1 in 7 have mental health and addictions concerns and do not have a primary care provider. Slightly more females have mental health addiction concerns compared to males, and the proportion of individuals with mental health concerns varies with age. So this is not specific to adolescents or seniors. This is actually a thread that runs through virtually every age of our population. And that 70% of those with mental health addiction concerns visited an emergency department between April 2018 and March 2020, and is even more in 2023. And this, again, is reported to us from the Ottawa Valley OHT. And the reason that Jama Watt and her team at OVOHT are looking at this is because as they identify the priorities for the work of the health team, as does Four Rivers, they have prioritized issues related to mental health and addictions very high on the list because of these statistics. Right? We've talked about diabetes, we've talked about high blood pressure, we talk about a lot of things. We often don't talk about this, but we know that being a thread throughout the population and with these statistics, it's not something that we can ignore any longer. So when we look at that through a paramedic service lens, we know that the number of mental health addictions related 911 calls is increasing, and that 70% of the primary problem indicated related are behavioral and psychiatric in nature. So these are medically managed or could be medically managed, as well as supported in different ways. And when we think about that, 3 out of 4 of each of those 3,267 calls were urgent. These came in as lights and sirens and urgent calls in our community. So Laura gets to meet people in a certain way, and the OPP meet people in a certain way. We meet people to the tune of 3,267 from 2022 to 2023, so that's January to March. And when we look at that number, we know that we have a special relationship with these people. We have a trusting relationship with these people. But we've been doing the same thing over and over in terms of how we support them or don't support them, depending on the need of the day. And what does that look like in terms of our emergency department partners? Again, 1,500 to 2,300 MHA-related emergency department visits are made annually to Pembroke, Renfrew, and St. Francis Memorial Hospitals. That's who we had the data from. And 85% of the visits were related to a mental health-related syndrome. 15% were related to toxicity, so overdose. And 15% is a very high number when you think about the incidence. When you think about it in terms of diagnosis, depression, anxiety, stress, and alcohol-related are all very present as it relates to these conditions. So what does that mean for us? So, the opportunity for the creation of a mental well-being and homelessness response team or hub is proposed to provide community-based mental health assessment, monitoring, treatment, referral, and so on. And that this would be a partnership is what's being proposed between community paramedicine, our partners, certainly in community services, and that we envision both a registered social worker and a homelessness support worker be a part of this team. But really this would be flushed out once we have a green light so that we can meet with all our partner agencies and who can bring what to the table. And in doing that, we envision it in both prevention and response. We know through those 911 calls that I talked about that there are many opportunities to be able to change the trajectory of someone's care or get them access to different services without having to go through an emergency department in our community. We know there are crises lines, there are volunteer organizations, there's a significant amount of potential help out there. The idea here is how do we connect people, whether they have a home or they're homeless or they're advanced in disease processes such as Alzheimer's, delirium, dementia, depression, and working with Behavioral Supports Ontario, for example, and advantaging our seniors population in alignment with our strategic plan. We envision this being between 12 and 16 hours of services a day. We know the OPP have a program currently for a subset of the population that they've done an excellent job of supporting. We also know there are many hours in the late evening and overnight periods where there are not services such as this. So we could flex the availability of this service and then also use this service as a resource for 911 paramedics and not necessarily having direct contact with the patients, but being a resource, so calling on Laura's staff to be able to guide people through the process to be able to access the services that she spoke of. How do we do that as well in supporting other crisis workers and other clients in crisis throughout the county? So again, our goals to ensure that people have access to a full range of health quality services, to connect clients, to leverage existing programs, to align with the priorities not only of the county and our strategic plan, but also that of the province, of Ontario Health and Ontario Health Teams. And Ontario Health Teams has identified this as a goal of theirs. So we intend, with your endorsement, to work very closely with them so that we don't duplicate services, but that we complement services and use our relationships between community services and the paramedic service to be able to ensure that no one is left suffering in our community, to partner with allied agencies, and I think importantly, it's proposed that the timelines for initiation be aligned with our budget process. This is not a give me the green light today, let's go. This is a allow us to be able to move forward in the fourth quarter of this year in a methodical way so that we can then identify alternate funding sources that may be available for this work. We can create a terms of reference and that we can lay out what the budgetary costs and the operational opportunities are between our departments and other organizations outside of the County of Renfrew. So when we look at that, we would be very happy to invite other agencies and the OHT to be a part of the planning process. But to go there, I think it is important that we have your endorsement to be able to move forward. So there was a recommendation provided as part of the addendum sent out to you, and I'm sorry that it came so late, but I think given the timing of the budget process, we need to know whether we have a starting point in this conversation or not. So from there, Mr. Chair, I will turn it back to you and be happy to stay at the microphone if there are any questions regarding this portion of the meeting.
Thank you very much, Chief. I'm wondering perhaps I know that I was remiss just prior to calling to order in discussion with Mr. Kelly, the CAO. We did need to amend the agenda. There is, in fact, a closed meeting at odds with the report that was sent out last week. But I'm also wondering if, in doing so, if it may be more appropriate to advance the addendum, item number 7, from the Health Committee, which is germane specifically to this report, if we might actually introduce that at this time, it might make more sense so that we can fully engage with questions on the presentation under the auspices of a resolution being on the table. I'll leave that to Mr. Kelly, your suggestion.
Thank you, Chair, and good morning. No, normally, I mean, so how the agenda was drafted, to get into the weeds very slightly, normally this report would have been delivered by the chief and staff during their regular reporting structure. What we wanted to do, knowing that this would be coming kind of late because of timing, we put it as a delegation today to be considered. And so it was a tip-off, at least, that this would be coming. That's why we listed it as we did in the agenda. That said, I have no issues moving that up in the agenda to discuss it now. I think that would be pertinent to do that.
Okay, thank you. I don't know, I cannot recall the practice. There is no agenda approval as part of our standing order, whether we need a resolution to amend the agenda or if you are satisfied, Mr. Kelly.
Yeah, you're correct. Procedural bylaw doesn't allow for that. So what we would do, just for open and transparency, is note that there will be a closed item to talk about the pending or disposition of municipal lands. And that's, as long as that's recognized, we will update the agenda for the minutes.
Okay, thank you. And I will also use my unfettered authority to advance as chair. I just want to be clear on that. I don't have an intrinsic unfettered authority. I think it's appropriate to bring forward item 7, and I certainly appreciate the resolution. I recognized when I received the report, when we all received the report, that there was this coming forward. So I'm actually pleased to see that there is a resolution to actually begin the process that was part of the addendum. So what I will do, I would like to for those who have it open in front of them, the addendum, I would invite now a motion. One of the, I would seek some slight amendment to the resolution, but I'm going to read what was sent out. We'll get it on the table, and that will form the basis for the discussion that's about to ensue. So, on page 1 of the addendum, item number 7, Mental Health, Addictions and Homelessness Hub, recommendation that Health Committee direct staff to establish terms of reference and funding options to create a mobile health hub. Could I have a mover, please? Moved by Councillor Purcell, seconded by Warden Emo. With that, before we engage, I just discussed briefly with the chair, I think for, rather the warden, I think for our purposes, just a little bit more clarity. So as chair, I do not move or second resolution, but this, as a suggestion, what I would propose a slight amendment, perhaps friendly amendment, that Health Committee direct staff to draft terms of reference and investigate funding opportunities to present at the October Health Committee meeting for approval. It is a slight variation, but I think as opposed to establishing the terms of reference, that it is still subject to the oversight of committee. So could I invite perhaps a member of committee that would move that friendly amendment? Warden Emo, seconded by Councillor Lafreniere. So on the amendment itself, which is subjecting this to the approval as opposed to the establishment, any questions or comments? All in favor? That is carried. The amendment is carried. Now, I would open it to any questions or comments on the presentation and moving forward, and I will begin with Warden Emo.
Yes, just a couple of points to the slide that talked about using hotel beds. One of the weaknesses of the hotel bed model is that any significant community events like Ontario Winter Games, Silver Stick, the recent fiddle, and I'm sorry I've lost the name, but the fiddle music Fiddle festival.
Step dancing and fiddling competition.
Okay, yeah, I just couldn't. I didn't want to be rude. That happens in September. It causes people to be moved out, to fill those beds, and that's disruptive. And you lose some people for a while, and then you have to re-engage them to get them back into the program, and and there's trust issues, and so relying solely on it is a struggle. And then a comment. Increasingly, we've known in this room and in all council chambers that municipalities have a much larger role in health care. I don't mean health care with the big H, big C. I mean with the small h, small c, where we are responsible in a lot of instances, whether we want to be or not to be, to set direction and ensure the health of our residents. We're also much more nimble than our provincial friends and federal friends who have very set programs, and they're a little looser now than they used to be, but their criteria and their service models are entrenched in stone for the most part. They do change through time and through partnership and through practice, but they're not as nimble as we are. And I think it's come to be expected. We are on the front end of trying to respond and build either alliances or programs if there's a hole, and then find others that can either take it on or support us, or we end up developing it ourselves. So this is not uncommon for us. It's now being acknowledged. It's seeking our expertise to resolve and assist some of the problems that are in the community. I think this is an excellent model. And I like the themes of collaboration with others, filling the gaps. Not, too many times in services we have overlapping circles, and we just need to pull people a little bit apart. And services, and so we can fill the gaps. This is just another gap, though. I don't think we can pull anybody apart to fill it. I think we have to fill it. Homelessness, the people that are homeless don't trust the system. If you can bring the system to them on a demand basis right away, you have some success. If you meet them today and say, I can't meet you until next Thursday afternoon, you'll lose a chunk of them. So I think, they have health issues. This program allows them to address some health issues, which they may not address until it's too late in a number of instances. So I think it's a vulnerable population that chews up a lot of resources because we don't understand them, and I think this allows us to understand them and to support them. So I'm really glad we're doing this, and I think it's in keeping with not our traditional lane, but I think the evolving lane of what we're doing as municipalities to look after the health of our community. So thank you for bringing this forward to both departments and the CAO for indulging some whimsy in conversation, and then with Mike and Laura putting together.
Thank you. I'd move now to Councillor Lafreniere, please.
I'm so pleased to see this coming forward. Like overjoyed would be more the word. I hear what Warden Emo is saying, and he's absolutely correct. The systems that are in place now have been in place for a long time, and it's time to start looking at them because they were working before. Now they're Band-Aids, and as Warden said, you can, in the terms of detox, so let's say someone identifies they need to go to detox. Right now they have to go to Ottawa. They can only stay for 7 days, then they get booted out. They do have some work that they do there with the community mental health workers in Ottawa. However, they can't be placed right away in a treatment center. We all know that. So they get bounced back to Pembroke, where they start using again, inevitably. It's a cycle. So we need to get them and keep them somewhere in one spot while we know whether they need help or not. So, I mean, there's so many partners in this, you're right. Right now, the police will pick individuals up that no, they don't belong in jail, they belong in a treatment center, but what do they do with them? And the names, the departments that are involved go on and on. What I envision is somewhere, I mean, the money that we're spending, as you said, on hotels, wow, it's staggering. If that money could be put into a warming station or a temporary shelter that we control, they could be sent directly to a detox facility in the same hub, and then the mental health workers locally could work with them. I've talked to many individuals over the summer that are dealing with family that have homelessness or addiction. The biggest problem with them is, why are we sending them out of the county? I've talked to mothers who said, at least when they're homeless here, I can make sure they get groceries, or I can take them in the odd time when they're not too volatile. But it's a frustration of our residents that our loved ones are being sent. And I have a nephew right now who used the grind, who was up in a hotel, and the department has helped him in many ways. They paid his rent for a month. Inevitably, he got kicked out anyway. He lived at the grind. Then he was homeless. Then he was given a bus ticket to Ottawa where he lived at the Shepherds. So it just goes on and on. Why is he there when he could be here, where his family is? So thank you for bringing this forward. I could go on and I could speak about this. One thing I do want to say, though, is I know that we can't give it the green light right now, but there is an urgency in our community. The cold weather is coming. So I know that there is something happening and the county will be involved, something to establish a green light on some type of partnership for a warming center, to begin in November. And I'm just going to put that out there because there is more information, I think, coming forward, an invitation to become a partner. So anyway, I'm excited. So thank you.
Thank you. Councillor Nicholson, please.
Yeah, Chair, we didn't get a copy of that PowerPoint presentation, right? I can't find it in my email.
No, it has not been distributed, but I'm assuming it will imminently.
Just because I'm getting, if I could get that, if that could be emailed now, and if we could just take a couple minutes to go through it. I just want to make sure I understand what was presented and some of the other comments that are being made, just so I can get rather than flip back through the slides, if that's possible.
Yeah, I'm not sure, Ms. Shapiro, is that something that you could distribute at this time to the committee? Emailing? Okay, and you are emailing it now? Thank you. Mr. Kelly. Councillor Purcell.
Thank you, Chair. I echo Councillor Lafreniere's words in regards to the homeless addiction and mental health issues. And Chief Nolan, I thank you for your support, and also Ms. Lapine for your support. I know that you've presented in front of City Pembroke Council discussing the homelessness issues. Unfortunately, City of Pembroke is at the brunt of these types of issues. And the reason that we're at the brunt is because we are a service city. We have mental health supports, we have addiction supports, we have organizations such as the Grind that's providing services. We also have, Ottawa Royal Mental Health. We have various different resources and service providers. So, when you talk addictions, mental health, and homelessness, we've also just recently completed, as part of the City of Pembroke, and it was a joint venture, our community safety and well-being plan. And to nobody's surprise, the top three in terms of risks for all our municipalities is addictions, mental health, and homelessness. Just as Councillor Fernier stated, we have an urgent need. We have 44 individuals currently in the City of Pembroke that are considered homeless, 44. November 1st typically is when we have an Out of the Coal program. That Out of the Coal program is no longer being supported by the Grind. So there is no warming center. There's no place for individuals, these 44 individuals, to get warm. Previously, it was held at the Grind, and those individuals, based on the situation, were allowed to warm, but they couldn't sleep. So now you put in sleep deprivation to somebody that has addictions, issues, potentially, and now you've got a bigger problem, right? So I think we need to really kind of look at this joint opportunity, to look at this hub. And I look forward to, and maybe the question I have for everyone here, or at least for Chief Nolan and Ms. Lapine, is that will you be participating in Monday's roundtable discussion that's been, I guess, organized by Jen Watt in regards to looking at opportunities to support substance use collection action. And it's a planning day. It's scheduled for September the 19th from 1 to 4. It's at Shady Nook Recreation Center. And again, it's facilitated by Jan Watt, also the Ottawa Valley Health Team, Brian Bocart, County Renfrew and District Health Unit as well. Kayla Shute is also going to be there. So there's an opportunity for us to kind of have those conversations, look at an opportunity for a collective group think in regards to next steps. I will be making a notice of motion and for the next meeting that we look at supporting a warming center, on an urgent basis and looking for that funding for that support. So I think that being said, there's an opportunity for us to do something. We all recognize that it's not just a Pembroke problem. It's a Renfrew County problem. It's a provincial problem. It's a federal problem. But we need to work collectively and utilize the resources that we have to ensure that we don't have people out in the cold freezing to death this winter. So thank you so much.
Thank you. Mr. Kelly.
Thanks for the distinction. And thanks, Mike. Thanks, Laura. Thanks for making this happen in a short time. A lot of this was discussions had at AMO with my peers and with other elected, of course. So what we're seeing in other municipalities, London, Kingston, Belleville, are hubs, community hubs. They're physical spaces. Now, I'm not going to presuppose the work that the terms of reference will do, nor will our partners suggest. But the impetus of this is that the vast geography of the County of Renfrew doesn't really allow for one physical hub in any real location to make a sizable difference. And the thinking on this would be mobile in nature. And this is why I reached out to the chief to say, what do we have? What infrastructure do we have? We have paramedics on the ground. We have perhaps paramedics that are able to do other duties and have a passion for, I'll call it the social work piece of paramedicine. And of course, with Ms. Lepine's crew, we already have, I'll call them crisis support workers for the sake of a better term, out in the field. So the impetus of this was, can we create a mobile hub to support people in Pembroke, but also in Arnprior, in Barry's Bay, in Palmer Rapids, or in Stonecliff? Because there is an invisible homeless out there too, and there's a lot of invisible mental health. And I think if we're not on the road, if we're not checking this out, doing those wellness support hubs or the wellness support checks with our friends in the OPP or otherwise, we're missing out on that greater good. So I just wanted to kind of Coles note it, especially for Councillor Nicholson, on where our thinking was at. But I just wanted to lend that to the conversation. Thank you, Chair.
Chief Nolan, you'd like to respond?
I would to the previous question from the councillor from Pembroke, and that is that yes, we will be participating fully, as will Ms. Lepine's department, because we share the passion, and I think we have something to contribute. And the timing, the tempo, and what it ends up looking like will be really, I think, the recommendations from these chambers on a go-forward basis. Our responsibility is to bring forward some sort of coherence in terms of our best contribution at this point, but I expect we'll learn lots on Monday about how that can be dovetailed with other experiences should committee and council choose to move forward on this.
Thank you. Any further questions or comments? Councillor Murphy, please.
Thank you. I think this is an amazing initiative. I'm just sort of flipping through the PowerPoint, so thanks, Neil, for asking for this. I am in full support. However, I will note that I think it's disgraceful that in our country, that the federal government and the provincial government are not taking care of some of our most vulnerable citizens. Thank you.
Thank you. Councillor Nicholson, follow-up.
Thank you, Chair. I'll echo. I think the work that we do sometimes goes unnoticed amongst all of the other things that are on our agendas. And to get this highlighted again, what happens in community services, what's happening in health, this is a good reminder, and it sets. And I think you've proposed at least one example where we can synergize between the two and reach out with those services. Now, what we've heard from the two members from Pembroke is that there are still other gaps out there. There are significant gaps out there. And as what Mayor Murphy, Councillor Murphy has indicated, is we and the warden, we have a responsibility to try to fill those gaps. I just want to make sure though that it's clear we can't fill all those gaps, but we can provide the leadership. We can provide the impetus. The leadership in this room can pressure the organizations to come together and find a solution. But I don't see it being just a Renfrew County solution. I think we need everybody at the table. You've made mention to the OPP. They have the mental health nurses that do the ride-alongs. We have the hospitals who are the ER departments. It's a significant impact on them. They have to be players. The OHT, these are just some of the organizations and the not-for-profits that are already out there doing these types of services in our community. We need to bring them all together and synergize. And if that leadership component is what you're seeking for our support today, tremendously. I am 100% behind it. I just don't think we have 100% of the solution. We may be able to provide that environment. I'll just add one extra point, and I heard it with when CAO at the briefings at AMO, was just that diversion. You know, when somebody has an incident and they drank too much, and I think this was a direct example that was provided at AMO. Traditionally, what would we do? We'd all call a friend, right? I've had too much, or my friend puts me in a car or a cab and gets me home to my partner, and they make sure I get tucked in at bed. A homeless person doesn't have that support. Where do they go? The 911 shows up, police shows up, takes them to the hospital. In Toronto, they've bypassed, they have a not-for-profit, I don't want to say drop-off point or warming center or whatever, where they can divert those patients to get the support they need and still keep their medical supports available for medical needs. So an example of where we're putting our best tax dollars in the right spot. But again, we can't solve that problem. We can only be a partner in that solution. So yes, I'm very encouraged. I'm very supportive, but I want to make sure we go into this with our eyes wide open. Thank you.
Thank you. Anything further? Councillor Frenier, follow up.
Yeah, just follow up. I agree with everything that's being said. I think a mobile outreach component throughout the county is, it's a must, because you're right. A lot of those individuals are moving to Pembroke, but a lot of them are not. They're getting lost in the weeds, and they don't have the ways or means to travel through the large county to get where the services are. So I see a combination, a mobile unit, but there does have to be a facility somewhere that doesn't move around, where, as my predecessor, the previous speaker said, somewhere to divert these people. So you pick them up, you drop them off at a warming center or a detox center. There has to be somewhere where you can hold them in one spot and get the help they need. So thank you.
Thank you. If there's nothing further, I am too in support of this. I also want to preface that, as many of you have, want to congratulate and commend Ms. Lepine and her staff and Chief Nolan and his staff on bringing this forward. I think that as we have seen, and in fact, Councillor Purcell had made reference to the community safety and well-being plans that are underway as they pertain to the County of Renfrew with the 3 detachments. There is substantial overlap between the Upper Ottawa Valley Detachment and the Renfrew detachments. While it will not describe a perfect circle, the Venn diagram of those two is being conducted by the same individual, Mr. Patrick Finnegan, and there will be substantial overlap between them, and it is serendipitous that Councillor Purcell brought that forward. Certainly, Councillor Nicholson will be aware the heads of council with respect to the Upper Ottawa Valley, CSWB, do have still like kind of the final working draft pending further proofreading, etc., that is front of us, that is in its final draft version and intended to move forward. And certainly for those, and Councillor Grills, you will have received that as well. Certainly Councillor Emo, Councillor Weir, you within the Renfrew detachment, catchment, and to myself as it happens. The expectation of Mr. Finnegan is that probably will come in October to move forward. This is certainly consistent with that community safety and well-being planning process. As a couple of councillors had noted, ultimately, the homeless, those suffering from mental health issues as well, compounded perhaps often with mental health issues, depending on who they are presented to is how they are addressed. And when it is policing, it is from an enforcement perspective. I think, as we hear often from Chief Nolan, the aspirational goal is always to be the right service at the right time in the right place. And that continues to be so here. What I would suggest is this is a very broad issue that we are confronted with. And I think in keeping with Councillor Nicholson's comments, it is within our purview, within our wherewithal to be a leader within this in our community and leverage the other two levels of government, as noted, that have not filled that space, as Councillor Murphy has noted. And I think that it is going to be multi-pronged. I think it's appropriate to move forward with this and being careful of spending a lot of time around the boardroom of designing the perfect solution that's going to address this. I don't think that's available to us. If I'm understanding Councillor Purcell correctly, and we will get to that while we were engaged here, I did provide him with a copy of the county's procedural bylaw, that it is his intent to bring forward to the next Health Committee meeting a motion, providing notice today, later in our meeting, to bring forward something with respect to a physical located hub, as opposed to the mobile or decentralized hub. And I think that there are going to be a variety of responses needed to address this. In all of this, the term that has been applied, these are people leading precarious lives. And they must come along with all of this. One of the terminology that fairly recent is no one is left behind, so we must ensure that no one is left behind. In any event, I think that it is outstanding to take that first step, but of course this is a 1,000-mile journey, and we are all on board for that journey. If nothing further, then I'm going to go back. We have the resolution before us. All in favor? That is carried. Thank you. And with that, then, we will go back to the start of the Emergency Services Report, which can be found on page 2. And Chief Nolan.
Thank you, Mr. Chair. Item number 1 in today's report is related to the expanding community paramedic programs, formerly the HISH, or High Intensity Support Program from the province. As you know, our community paramedic program receives funding from a number of different sources. Some are legacy funds, some were popped up through the pandemic with, I guess, the subtitle of being a pilot program. And HISH was one of those programs where originally the province gave us $133,000 per year. And then very recently, as part of your package, has confirmed that amount will be increased to $231,700, and that will now become base. And what base means in provincial language is that is now a permanent program funding allocation from the province. So happy to move beyond the pilot phase, happy to move into a base relationship for funding with the province and Ontario Health, and we'll continue our work with the Ministry of Long-Term Care to seek base funding for the community paramedic and long-term care funding as well. But that is really a good news item for us. And part of the reason we went from 133,000, and I'm sorry, there's a zero missing there, to 231,700 was that last year there was additional funds remaining, and we had to put in a proposal very quickly to identify how we could use additional funds. They did fund us the additional amount last year, which brought us up to the 231,700, which became our need amount, which then has become our base funding. So I'm pleased that Deputy Chief Grenier moved very quickly to be able to take advantage of those funds to be able to use those services to support our vulnerable populations in our community, and now that has become our base funding going forward. So that is good news. Item number 2, Mr. Chair, is related to the dedicated offload nurse funding. So this program has been available to large urban emergency departments across the province for many, many years, almost 2 decades. What we're able to achieve this past year is to make this funding available to mid-sized hospitals. So it was the Pembroke Hospital and Renfrew Hospital that were eligible based upon their volumes and their offload wait times. So we worked closely with the administration of both of those hospitals and put in a funding proposal to the province to be able to provide staffing, and that staffing can be a nurse, that staffing can be an agency nurse, that staffing can be a paramedic, it can be a respiratory therapist, it can be a number of different types of providers, but all with the purpose of increasing flow, reducing offload delay, getting paramedics back into the community, and being able to have a smooth transfer of care with the hospital. So very pleased that this government has come forward with $421,000. Again, it says one-time funding. The dedicated offload nurse funding program that's been around since the early 2000s is one-time funding as well per year, over and over and over. So we need to get off of this carousel of pilot programs and actually move forward. But this is great news for us because now rural hospitals have access to this funding through the paramedic service. So the county will receive the funding from the province. The paramedic service will work with the hospital in terms of that memorandum of understanding, which will be coming back to these chambers, and the most appropriate provider will be identified. Don't want to muddy the waters with the fact that we have paramedics working in the Pembroke Regional Hospital Emergency Department and the Arnprior Regional Hospital, and that's based upon our partnership and collaborative approach to a program that's very similar to this one that's newly being funded. So there may be an opportunity for Pembroke to exercise this funding to be either complement or offset the existing model that we already have in place. Whereas in Renfrew, this will be a new program should they choose to work with us based upon this funding allocation. So very pleased that the province is acknowledging that offload delay is not just a large urban issue, but in fact affects rural hospitals and rural paramedic services as well. Item number 3, Mr. Chair, related to the Ministry of Health, additional land ambulance services base funding. So the good news is that we now know how much money we can spend in 2023, 9 months into the year, and the allocations are based upon the previous year's amounts. But I'd say the punchline on this is that the province is providing us about $20,000 more than we had budgeted to expect to receive from them in the first place. Craig, is that a good way of putting it from your note? So said differently, we were extremely accurate when we're talking about the number of zeros and decimal points here in our estimation. So thank you to Mr. Foss and the Finance Department and my staff for having a crystal ball to be able to land us within $20,000. And in this case, the province's grant is for roughly $20,000 in excess of what we had anticipated for our budget amount for this year. Item number 4 is the primary public safety answering point, and we have a letter there from Municipal Policing Bureau regarding the 911 PSAB services. So you remember that the Emergency Services Department, we do fire dispatching, the 911 contract for all of the municipalities, as well as disaster management and the paramedic service. So this is one of our portfolios, and there is a letter there for your review on the renewal of the PSAB agreement. Item number 5 is a presentation that Commander Amber Hultink and Heather Quinn, who's an advanced care paramedic from Halton Region, will be providing, and they're hosting a webinar with Dying with Dignity Canada on Wednesday, September 20th. And I'm very proud of Amber, the work that she and her team do as leaders in palliative care, and a reminder, because this predates some of you in these chambers, that in 2018-2019, Amber was seconded to the Canadian Foundation for Healthcare Improvement as the Canadian Paramedic Improvement Lead on paramedics providing palliative care in Canada. So really happy that that opportunity occurred and that she is continuing to be identified as a thought leader in that space. Mr. Chair, we have bylaws listed here. How would you like to proceed from this point?
I think actually we'll pause briefly there and review the information items. So, committee, going back to information item number 1, expanding community paramedic programs, the formerly HISH. Any questions, comments? Same question with respect to item 2, the dedicated offload nursing funding. Councillor Nicholson.
Thank you, Chair. I understand it's flow-through money from the province to us to flow through to the hospitals. Is there any option for us not to provide funding to the hospitals, but services instead of funding?
Chief Nolan.
Thank you. So there are very specific criteria with funding allocation, and really this is a partnership approach. We can certainly, and we will, be having the conversation with Pembroke Regional and Renfrew Victoria as per the funding agreement in terms of identifying available staff, because we will not be flowing funding if there are not staff available to provide these services, and there are performance requirements associated with offload times and so on. We do know that we have very successful programs both at PRH and at Empire Regional Health as it relates to the paramedics providing the services that you're describing, but that would be the outcome of the conversation, and to better understand what capacities that they may have internally to be able to provide these services, or whether the paramedics would be a preferred choice in terms of providing staffing. Certainly, we know the benefits from our experience at Pembroke and in Arnprior, in that not only is it a direct benefit by having the staffing available, but it also allows for an ease of transfer of care. And the feedback that we've been receiving from those hospitals is that it's been very well received at the staff level as well. So I do see us being able to offer the ability to provide the services, but the funding flow through would then likely continue to go through the county to the hospital, back to the county, so that the accounting associated with those dollars is consistent with all other programs in the province.
Follow-up, Councillor Nicholson.
Yeah, thank you. I appreciate the explanation, Chief. And my key is I just want to see the services delivered for the money that we're providing. So I'm glad to hear that there's a number of ways for us to achieve that. Thank you.
Yeah, and it's important to keep in mind that ultimately, by whatever means, if we reduce offload delays, the paramedic service and the residents of the county of Renfrew are the net beneficiaries, regardless of how this is funded. Councillor Renfrew.
I was just going to say what you said, so that's fine. Thank you.
Thank you. Anything further on item 2? Moving on to item 3, the Ministry of Health Additional Land Ambulances Services Grant. This is the first I've actually seen this document. I inquired prior to coming to order whether it was Chief Nolan or his staff that had put this together. It seems very rudimentary. And the challenge for me is not having a degree in quantum physics. I'm finding this chart on page 11 somewhat incomprehensible. Trying to arrive at, if you wish to join me on page 11 momentarily. So I understand the top line, $19,220, which precisely was the provincial grant in 2022. I am at a complete loss to understanding the less 100% base funding to remove $82,600 and then restore it down near the bottom. And in particular, what caught my eye was the incremental increase proposed, which is line 4 from the top at $0. And all of this because ultimately, if committee returns to page 3, you will note the very last number in item 3 references a $9,666,479 grant. It also says within this paragraph that they are providing us an additional $350,000. Our actual approved budget or expectation of the provincial funding was $9,647,743. I took this directly from the final approved county budget. So in fact, there is a net gain over what we budgeted of just under $19,000. So I'm very pleased that the province is confirming that they will continue to fund half of the 2020 or half of our 2023 paramedic services, the legacy services, the 911 services, if you will, predicated on the 2022. It is always pleasing when the province identifies that they will do what they are supposed to do. Moving on then to item number 4, primary public safety answering point. Item 5, the role of the community paramedic. Very pleased, as always, when I am seeing the various outreach, the various utensils within the Swiss Army knife that is the paramedic service, and in particular the community paramedic service. Moving on, Warden Emo, item 5.
Thank you. The information, especially the presentations, are always valuable because you get asked questions. I'm sure all of us get asked questions. So these are great to have. In the preceding deck, where we have current information on needs in the community, are very valuable. And then also when we get out into the community, into the municipal community, and we're making presentations at AMO and Roma and OEMC and NOMA and FONOM, it's really good to have a pile of these to pull information in. So thank you for that, because one of the things we can say all the time consistently is anything that comes out of our paramedic services and anything that comes out of all of our divisions is well researched, and especially in terms of BTAC and community paramedicine, like we've established the standard on how to measure our results and then how to tweak the service to meet our community. And so I don't know if you're aware of this, but we are sector leaders in this, and it's very well respected. Chief Nolan and I made a presentation to OAMC. Our presentation was about 20 minutes, and then we had about 20 minutes of questions. And then in the hallway, I spent probably another hour, and I think Mike did, talking to other folks as well who come up with questions and really wanted more information. So, thank you for this. I'm glad we have this. Keep doing it, because it's nice to see the presentation we did at OEMC had six papers, I believe, or 8 papers, I can't remember, on the bottom, and people wanted to make sure they got those so they could go and check the research. So this is very important to keep doing this, so thank you.
Thank you very much, Warden. I think that does bear repeating on a frequent interval, certainly within the Health Committee, Chief Nolan and Mr. Blackmore, but I think right across the county of Renfrew should acknowledge the incredible competence of our senior staff, because it is foundational to change of having solid information. That is not necessarily going to guarantee changes that we are seeking, but in the absence of that, it is next to impossible to realize change and evolution. So we're very, very fortunate to have an incredible senior staff here, and I think that was reflected. All of the papers that were presented at the delegations at AMO were all circulated, and I think it does attest to the initiative and effort of senior staff. So thank you, Warden, for bringing that forward. Back to you then for bylaws, Chief Nolan.
Thank you, Mr. Chair. Shall I read the recommendation?
Please.
That the Health Committee recommend to County Council that a bylaw be adopted authorizing the Warden and CAO clerk CAO to sign a renewal of the agreement between the County of Renfrew Paramedic Service and the Empire Regional Health to deploy paramedics in the emergency department. Mr. Chair.
Thank you. I'd seek a mover, please. Councillor Wilmer, seconded by Councillor Nicholson. Back to you, Chief Nolan.
Thank you, Mr. Chair. So to make a distinction between this agreement and the dedicated offload nurse program, the Empire Hospital, Empire Regional Health was not eligible for that funding given the size and volume of patients that they have. However, I'm very pleased to say that we have an excellent working relationship with the senior administration there. And going back to, I think it was a Christmas Eve that we began this program in attempt to keep the emergency department open and to be able to support them in an innovative way. This has now become a very, very sought after agreement from my peers so as to create a formal relationship between the paramedic service and their local hospitals to be able to provide really bi-directional support. But this does lay out the existing agreement, save and except the fact that this agreement is in effect from June 1st, 2023 to October 7th, 2024. and the scheduling of the paramedics in the emergency department, principally in the triage role at the Empire Regional Hospital, also does extend to the occasion where paramedics are providing support in the emergency department, shoulder to shoulder with the nurses and doctors, so as to support significant events as well as keeping the emergency department open, which is of critical importance to all of us in this community. So this is a renewal agreement for your consideration, Mr. Chair.
Thank you. Committee, you've heard the resolution, the background. Any questions, comments? Just one point that I would like to make. I think that at the outset, Chief, you did allude to the very first instance of this, which was to forestall a potential for having to close an emergency department. We have become, unfortunately, used to short-term closures of emergency departments. It is very uncomfortable, and I cannot recall a time in my life when we have seen this, and it is becoming an acute problem. And I am certainly in support of this, again, from the perspective of our broader community, the people that inhabit the county of Renfrew, that they're going to be able to continue to have these services. As we've noted, we have, through multiple initiatives and efforts, arrived at diverting those who would otherwise be going to emergency departments. We are continuing that. We had a very lengthy discussion today with respect to mental health. However, all of this is not, it is addressing the challenge in the short term. It is not the solution. It is incumbent upon the province of Ontario to step forward and address this. We are just short of a crisis situation, and it is imperative that this be addressed at a very high level, and that we are not putting in place measures to avoid emergency room closures, but in fact have appropriately staffed and resourced emergency departments that are available for the very folks that they're intended to serve. With that, off of my soapbox, Councillor Nicholson.
Thank you, Chair. I'm going to take your soapbox. Is it possible, or could we consider providing a resolution, recommending a resolution to County Council at the end of the month, stating something to the effect of, we are now providing X number of dollars to our hospitals in our communities in order to ensure that they stay open. This amount of service should be provided by the province. It cannot, so we are. Is that something where we can take your soapbox and send it up?
So I will turn to Chief Nolan. And I was remiss, perhaps, missed the opportunity. The paramedics that are, if you will, seconded into the emergency departments, both at Arden Prior and Pembroke, are fully funded by the province of Ontario. That should be made perfectly clear. These are not cost-shared services. So, Chief Nolan.
Thank you, Mr. Chair, and I think that that's an incredibly important point. And I will also state that as it pertains to other jurisdictions, so in Nova Scotia, for example, paramedics have functioned as a member of the healthcare team in the largest hospital in Halifax for going on 3 decades. So while this was born out of crisis, we are also seeing significant advantages to having a collaborative approach to care from an interprofessional perspective. What does that mean in practical terms? It means that we have a paramedic working in the emergency department who's often a part of the conversation as to who needs to be transferred to Ottawa and who doesn't. When is Orange coming? When are they not? How do we marry up paramedic crews to be able to optimize the number of patients coming through the department at any one time? How do we smooth the flow of patients coming and going from the emergency department? So there is an advantage to us that is 100% funded by the hospital, and suffice to say that this Arden Prior agreement really dots the I's, crosses the T's as it relates to issues of personal health information, information sharing, access to emergency medical records, and so on. So there is a benefit to the hospital, but there is also a sizable benefit to the paramedic service in continuing to nurture and culture this role so that we can reduce a number of the pressure points when it's an us against them type of attitude. So I'd just like to add that in, Mr. Chair, because I think that that's critically important. And the paramedics themselves are also appreciating this role as a professional arm of opportunity, so as not to necessarily be working in the community with other pressures placed upon them.
And thank you for the clarification, Chief. Certainly, there is inherent value returned in having these the paramedic folks engaged, embedded within the emergency departments, and I think on an ongoing basis that should be the org chart, if you will. But I think nonetheless it does remain that we are increasingly troubled at the number of times that emergency departments are being closed on a short-term basis, or in fact, in Minden, Ontario, it is to be closed or projected to be closed on a permanent basis. What I would suggest, however, Councillor Nicholson, is, and perhaps with some additional guidance by Mr. Kelly, this may not be the ideal place prompted based on this discussion, but perhaps as a notice of motion again that might come forward at the end of the month with respect to a position on the challenge within emergency departments. I want to be very careful not that these get tied together. That was not my intent when I spoke from the soapbox. Mr. Kelly.
Yeah, no, thanks. To you and through you, if a member wants to make a motion at the committee level, that is notice of motion to County Council. So that could be introduced here for consideration later on.
Okay, and the reason for that is I would like my ideally to be wordsmithing the resolution on the spot, on the fly today, might not actually capture the intent, given the time constraints and the time pressures that exist at committee, that I think it might give more time for some careful consideration of what the motion might be. Councillor Nicholson, does that sound appropriate?
Yeah, thank you, Chair. And yes, I would want to sit down with the chief and make sure that I understood exactly. I don't want to bite the hand that feeds me. I just want to make sure that we provide the right information to the right levels of government. So if I'll withdraw my request if that's what it takes, and we can reapproach after I have some time with the chief. Thank you.
Thank you. I think that would be appropriate. Much appreciated. Anything further on item 8? Seeing none, the motion is on the table. I'll call the question. All in favor? That is carried. Thank you. With that, I would seek a motion to approve the emergency services report, please. Councillor Purcell, seconded by Councillor Weir. A final opportunity for any question. Seeing none, all in favor? That is carried. It is 10:49. I am going to invite a recess until 11 o'clock just for a temporary break. So with that, Ms. Poplinski, if you could advise when we are offline. Thank you, everyone, for your indulgence. I'm going to go directly to Mr. Blackmore now to take us through the long-term care report, please.
Thank you, Chair. Through to committee, good morning. Your first item, number 1, is on page 19. It's the long-term care beds in Renfrew County. So at the request of Health Committee last meeting, we were asked to put together a table demonstrating the current number of long-term care beds, what's being proposed in terms of redevelopment and new beds. So the table in front of you demonstrates essentially what are 814 long-term care beds currently, with 7 respite beds, to an eventual 971 beds when all redevelopment and new beds are completed. Item number 2 is presents the quality improvement plans for each of Bonacieux Manor and Miramichi Lodge. Committee will recall that this is an ongoing commitment for the 2 accreditation standards. Item number 3 are the details of a public health inspection held on August 17th at Miramichi Lodge by Inspector Shannon Thorpe, and another example of an exemplary report for Sherry Hendry and the food services team. Item number 4 updates the delegation with Parliamentary Assistant MPP John Jordan, as attended by the Warden, the Chair, the CAO, and myself. A case for consideration to move to a per-bed funding versus CMI funding was presented. I'll note that since the delegation, we've been invited to participate in the technical advisory subgroup meeting with the Ministry of Long-Term Care sector, examining CMI funding for high acuity residents. And those meetings will commence September 19th on a bi-weekly basis going forward.
Thank you, Mr. Blackmore. We will return committee to the information items before engaging on resolutions. Any questions, comments on item number 1, the long-term care beds in Renfrew County? Councillor Nicholson.
Sorry, Chair, I'm getting feedback in my thing here. Just to come back to those numbers, 978. I can't remember what the current wait list was that was presented at the last meeting. Is that possible off the top of your head?
Off the top of my head, I think I'd be totally guessing, to be honest with you, but it's certainly, I can tell you that both Bonacieux Manor and Miramichi Lodge are roughly around 200 each. So I could find that out for you. I don't know off the top of my head.
Sorry, and I should have come with that number.
Sorry, if I can, yeah. I've just
thank you.
Was able to draw up the August, the total wait list right across all long-term care homes was 873.
So we have 978 beds projected once they're all built, and we have a wait list of 873. I'm assuming that maybe some of those beds not built yet will consume that wait list down to about 700. The question I want to put back, Chair, is that what is an acceptable wait list for Renfrew County? Should we be asking to increase more beds in Renfrew County, or is 700 folks on the wait list acceptable?
I don't think, I think that this is outside of Mr. Blackmore's pay grade, the answer to this question. So I shall indemnify you, sir. I don't appreciate it. I think it is a very difficult proposition to suggest what the answer is to that, Councillor Nicholson. We had this conversation at County Council with respect to the Community Services Committee report, if you recall, and the wait list. It's 12-month for the special priority populations, and it's 7 years, 84 months for others, which is a very gross number, and there is a lot of detail that has to be incorporated into that. So, you know, in the ideal, it is 0. We do not inhabit that world, nor will we inhabit that world. Very pleased to recognize that in this chart, you can tease out that it's just under a 20% expansion of the beds across the county of Renfrew, but it is hardly surprising. I go back probably 25 years ago when we were first discussing boom, bust, and echo, how the baby boom had so impacted at each strata of life, or each segment of life, whether it be schools, whether it be housing, and now whether it be the entry into the seniors population, the challenge of this significant demographic bump. When we were initially discussing the provincial government, this provincial government's initiative to expand the beds in long-term care, I'm going to guess just pre-COVID, probably 2019 or so, that there was a question with respect to whether the County of Renfrew itself, as the owner of two long-term care homes, two municipal long-term care homes, whether we would engage in a notion of expansion. What actually drove from that was that it was more appropriate to develop a seniors housing strategy that is going to take a much more broad and comprehensive view of what the needs of our senior community are going to be going forward. And I still think that that is valid, though you raise certainly valid and cogent questions, Councillor Nicholson. In the end, I don't have the answer to what is appropriate. One of the things that I will note, it is an unfortunate statistic point, but I think that our length of stay within long-term care has dramatically changed over the time that we've seen the level of acuity and dementia increase. There's been an inverse decrease in the length of stay. Typically, our seniors community have been more healthy, have been able to remain at home or in an alternate setting other than long-term care for a longer period, but they are, of course, presenting then much more acute when they come into long-term care. So it is a difficult thing even to ascertain what that length of list is, because we do have significant changeover with respect to our populations in the county long-term care homes, and I'm sure by extension into the geographical county 900 or future just under 1,000 beds. Follow up.
Yeah, thank you, Chair. The question for me is strategic in nature. If we've got 700 people on a wait list, I'd like to see, and I'm putting this out there, but I don't know how to proceed, so I'm sure you won't hesitate to tell me, but we have 700 people on a wait list. We know we can serve a certain portion of those with our community paramedics, right? So, okay, so let's just assume, just for a matter, 50%. So 350 we can handle on the wait list with our community paramedic system. The balance of the 350, is that a long-term problem? Is that a blip? Is that are we forecasting 20 years of being able to not be able to service those other 350 members of our community? And if that's the prognosis, if that's the plan, we're going to have 350 members always on this wait list, unable to get support from our community paramedics, what are we going to do about it? Is it seniors housing? Is it affordable housing? Is it more long-term beds? How do we get to looking or examining that strategic requirement?
It is a challenge. It's a very large question, and I think just based on our discussion earlier with respect to the outreach proposed with the Mental Health and Addictions and Homelessness Hub, this is consistent or certainly in alignment as to our approach. Perhaps as the starting point, even the data that would buttress that of typically how long are folks on the wait list, I think might be the first question. And I'm not sure, Mr. Blackmore, if through the Home and Community Care Support Services, if those data points and perhaps more that might be salient with respect to a strategic visioning on what our needs are going to be, if that might be available. Certainly we'll note as well that there is being proposed, as we are speaking, a substantial change in home and community care support. The administration, and essentially the org chart, the entity that will deliver that, is being subject to change. But Mr. Blackmore, is that information available?
Thank you, Chair. Through you to committee, I'm thinking that those should be statistics we should be able to glean from home and community care support services in terms of wait list trending, like where were we a year ago? Where are we today? What's projected for the upcoming year? Those are stats I can endeavor to achieve.
Okay, I think that perhaps as a starting point, I would make the suggestion, I would never propose or presume to tell my colleague from Whitewater what they should do or how they should do so. More than happy to provide some suggestions, recommendations even, but that would be one of them, that perhaps gaining some more insight into how long individuals are on the wait list might provide some guidance, recognizing that based on the PowerPoint presentation this morning, that will be a snapshot in time that will be valid as of the data point that we have. Certainly, I think that if we're seeing, and I anticipate that we will be seeing those wait list numbers increasing, but the salient point would be how long are those who are eligible and qualified for long-term care are waiting for those beds. Is that satisfactory or remotely satisfactory?
That's perfect. Thank you, Chair.
I strive for perfection. I don't think it was perfect, but thank you for that just the same. Any further questions? Seeing none, moving on then to item number 2, Quality Improvement and Safety Plan Progress Reports. Pleased at these. This was part of our accreditation process. This had been done on an annual basis. I believe it's quarterly is the expectation now, Mr. Blackmore. Any questions or comments? I see none. Item number 3, the District Health Unit, the Public Health Inspection. Certainly want to echo and give voice to the written report. Much congratulations to Ms. Sherry Henry, the Food Services Supervisor, and in fact her entire team at a clean report. And finally, item 4. Mr. Kelly.
Thank you, Chair. So I raised this yesterday during operations meeting and the importance of attending events like AMO and Ontario East, et cetera, but in this particular case, AMO. So this is a good news story for us. Of course, we had a delegation, as Mr. Blackmore mentioned in his report. Getting on the, or sitting at the big boys table, I guess, if you want to call it that, or the adults table, was really a result of an offhanded remark by one of the staff members that said, oh, by the way, we're putting together a task force to deal with something, and then reaching out afterwards to see if we can actually sit at the table. So this is a win as far as I'm concerned for attending AMO and making that presentation, and happy to continue doing so. But being, as Mr. Blackmore was, very acutely aware of what's going on in that meeting and hearing those opportunities to grasp, I'm glad that he will now be sitting at that table to hear and influence what's coming next. Thank you.
Certainly echoing absolutely, Mr. Kelly, those comments. I think that in trying to discern the value that is returned from attendance at the various conferences, the OEMC just having concluded, it is such a challenge because one cannot reap a harvest without first planting the seeds. So if you're not planting the seeds, it's difficult to actually have anything come from it. So in this instance, I think that it was very serendipitous that, as you note, that in this discussion of CMI, and how it has not been meeting what it was intended to meet, that the ministry is recognizing that and is examining a means of restructuring how they are approaching the dramatic increase in acuity of residents, both on intake and even current population. So very pleased, obviously recognizing once again the caliber of senior staff that we have here at the County of Renfrew to be participating in that. Warden Emo.
Thank you. Just to echo your comments and the comments of the CEO, I didn't attend any sessions at AMO. I didn't have time because when you did a delegation, you prepared for it, you did the delegation, and then oftentimes that generated comments or conversations after the delegation with either ministry staff or other municipalities. So it was a very packed agenda, and they were teasing me because I'd appeared before Minister Jones and the parliamentary assistant 4 times in 2 days with different hats on. So they were going to ask me to stay to answer questions. But I think the familiarity and the comfort level grew because they've seen us so many times. Good information. And this discussion was probably one of the more interesting discussions, because it was very frank. You know, it was a back and forth. What are you asking? Why? And we made our presentations, and then, as the CEO said, the opportunity came, and we said, can we join in on that? And you know, I think the inference was it was going to be an internal review and maybe reach out, and then they sort of expanded it on the spot, or maybe they intended to and just didn't elaborate. But anyway, it was a great feeling to walk out there going, wow, you know, and then the follow-up. So it is a grind to drive to London and spend 4 days hustling around, halfway around London on a regular basis from building to building. But it was worth it in the sense of this is just one of the examples, and we have about 3 other examples where we think we made significant inroads. And again, just talking about preparation and the research to back up what we're saying is so important. So thank you to Mr. Blackmore and the CEO Kelly for organizing and getting us, and we asked for the delegations, we got them all, and it takes a lot of work to put them together. And then to all the chairs, and Chair Donahue, of course, was able to carry his end quite nicely, so we did well. Thank you.
Thank you. Any further on item 4? Then back to you for resolutions, please, Mr. Blackmore.
Thank you, Chair. Through to committee. Number 5 is a resolution. It's a 6-month review for the long-term care home smoking policy. So just get into
if you would, perhaps if you would read the recommendation, and I will seek a motion.
Okay. Recommendation that the Health Committee recommends to County Council that policy G009, smoking regulations with a review date March 1, 2023, for the County of Renfrew long-term care homes, Bonnechere Manor, and Miramichi Lodge remain applicable for an additional 6-month period.
Thank you, Mr. Blackmore. I would seek a mover, please. Councillor Weir, seconded by Councillor Grills. Background, please.
Background, March 1, 2023, County Council supported the revision of the long-term care homes policy G009 smoking regulations, removing residents of Bonnechere Manor and Miramichi Lodge from the policy, permitting residents to smoke on the property no closer than 9 meters from the entrance to each home in compliance with the Smoke-Free Ontario Act 2017. At the request of the committee and council, the 6-month review has resulted in lessening the resident safety risk for those that were leaving the property to smoke. However, it has been noted there are a few new smokers seeking to use the designated smoking area. Staff is requesting that the County of Renfrew long-term care homes policy G009 smoking regulations remain applicable for an additional 6-month period to further assess.
Thank you, Mr. Blackmore. I'm presuming that new smokers are in fact those who might otherwise have ceased smoking and not those who perhaps in the later stages of life thought that it would be a good hobby to take up at this point. Any questions or comments? Seeing none, all in favor? That is carried. Thank you. On to the item 6, please, Mr. Blackmore.
Item number 6 is a resolution for a business case pertaining to restorative care staffing at Bonnechere Manor. The recommendation that the Health Committee recommend to County Council that the restorative care staffing complement at Bonnechere Manor is increased by 2 full-time physiotherapy assistant positions at 2,080 hours times 2 from existing part-time hours effective October 22, 2023, and further that the Finance and Administration Committee be so advised.
Thank you. I would seek a mover, please. Councillor Frenier, seconder. Councillor Yon. Background, please, Mr. Blackmore.
Background, attached as Appendix Long-Term Care 3 is a business case to support the redistribution of restorative care staffing hours by creating 2 full-time physiotherapy assistant positions from the current part-time staffing hours.
Thank you. Any questions or comments? Councillor Frenier.
Yeah, I just want to compliment that decision because, I mean, in light of the challenges that are facing every sector when it comes to recruitment, I think it's just very sustainable to have full-time people and that are going to be happy and as it indicates in the report also, better patient care, more familiarity. So good job. Thank you.
Thank you. Anything further? Seeing none, all in favor? That is carried. Thank you. And on to item 7, please, Mr. Blackmore.
Thank you, Chair. Through to committee. Item number 7 is a resolution seeking approval to proceed with the nurse call system upgrades for Miramichi Lodge. A recommendation that the Health Committee recommend County Council award the nurse call system upgrade Phase 2 and Phase 3 projects as per the County of Renfrew GA01 Procurement of Goods and Services Policy, Section 20.7, for the quoted price of $175,308.72, excluding HST, to Simtel Wireless RNA Technology Incorporated for KPI software, Smart Report Module, 30 corridor displays, and cabling and integration of Mitel head end, which was approved through the Miramichi Lodge 2023 capital budget, and further that the Finance and Administration Committee be so advised.
Thank you once again, Mr. Blackmore. I would seek a mover, please. Councillor Nicholson, seconded by Councillor Wilmer. Background, please.
In background, the sum of $200,000 was approved through the Miramichi Lodge 2023 capital budget for the nurse call system upgrade Phase 2 and Phase 3 projects. Simtel Incorporated Wireless RNA Technology Incorporated was the original installer and maintains a comprehensive contract for this equipment, and provided a total project cost of $175,308.72, excluding HST, for KPLI software, Smart Report Model, $11,522.25, 30 corridor displays and cabling, $98,920.20, and integration of Mitel head end, $64,866.27. Procurement of Goods and Services Policy GA01, Article 22.1C, supports that where only one source of supply would be acceptable and/or cost-effective due to compatibility or safety liability concerns. The requirement for competitive bid solicitation for goods, services, and construction may be waived under joint authority of the appropriate director and the chief administrative officer. Corporate Policy GA01, Article 20.7, award emanating from a request for proposal that exceeds $150,000 requires the approval of County Council. Staff is seeking committee's recommendation to County Council to award this project to Simtel Incorporated Wireless RNA Technology Incorporated.
Thank you, Mr. Blackmore. Committee, any questions or comments? I should note, and this may be germane for item 8. Ultimately, inclusive of net HST, there's anticipated to be a savings of just slightly over $21,006. I'm going to guess on item number 8, we're far enough along in the season that it may be problematic finding that examination, but it seems that perhaps there might have been funding found in item 7 towards item 8. In any event, committee, any further questions or comments? Seeing none, all in favor? That is carried, and on to the final item number 8, please, Mr. Blackmore.
Thank you, Chair. Through to committee, item 8 is a resolution seeking to reallocate capital funds to cover the cost for repair of an energy recovery ventilation unit at Miramichi Lodge. The recommendation that the Health Committee recommend that County Council approve the reallocation of $11,404 for the emergency repair to the energy recovery ventilation unit number 4 from the $25,000 previously approved in the 2023 Miramichi Lodge budget for a study for the energy recovery ventilation rooftop system, and further that the Finance and Administration Committee be so advised.
Thank you, Mr. Blackmore. Once again, committee, I would seek a mover, please. Councillor Nicholson, seconded by Councillor Murphy. Background, please, Mr. Blackmore.
Background, Miramichi Lodge has 4 energy recovery ventilation rooftop units, ERV, each one providing tempered 100% fresh air to each resident home area for 3 stories of the resident rooms. The ERV has a cracked exchanger that heats the air when outside air temperatures are lower than the room setting, and this requires replacement before the season's temperature change. As per Corporate Policy GA01, Procurement of Goods and Services 17.0, purchases not exceeding $15,000 shall include evidence that a minimum of 2 quotes were obtained, with the director having the decision authority. Quotes were received from Irvcon Limited at $11,404 and Valley Refrigeration at $11,613. The director is seeking committee's approval to recommend County Council approve the reallocation of $11,404 from the $25,000 previously approved in the 2023 Miramichi Lodge budget for a study on the ERV units to cover the unexpected emergency repair costs to ERV number 4.
Thank you. Committee questions, comments? Councillor Nicholson.
I caught the same numbers that you had said, Chair, and wondered if it was necessary to defer this $25,000 project, given that we do have some savings at item 7. And that can be my first question. Can we do that?
Just before I will invite Mr. Kelly to respond, I probably may have jumped the gun a little bit because I'm not sure. I think within both long-term care homes at the 6-month, at the second quarter financial report, I think both were in a deficit position overall. I have no idea where that might be. I'm not sure if this is predicated on the fact that we know that we have funding here. I would certainly defer in the absence of Mr. Foss. Mr. Kelly, to you.
Great, that's a good setup. So through you, so normally we come to council when we're transitioning one piece to another, so we understand their savings, but because we are, there's not that much variance, we just can't do something else because we have savings and something else, we have to bring it back to council because it is charted and identified in our budget, so we are formally moving things around with your approvals.
Back to you, Councillor Nicholson.
Good. I just note, Chair, that this is the second time, I think, that long-term care has presented emergency repairs. And in both cases, we funded by taking away from projects that were occurring this year. And I just want to make sure that we're not just kicking like if they're necessary for this year, I want to make sure that we try to do them this year and not just defer that expense to next year. If there are savings found, maybe we need to set aside some money in the next year's budget for emergency repairs. Otherwise, we're just setting ourselves up for the lowest priority gets knocked off every time one of these unforecasted events occur.
I do note that each of the long-term care homes does have its own capital reserve. I guess that was another potential. That was why I had perhaps offered the opportunity for Mr. Blackmore at this point. By the time council entertains this at the end of the month, we only have 1 quarter left. I'm not sure when it was anticipated to actually engage the consultant that was going to do the review. I would yield the floor, Mr. Blackmore.
Thank you, Chair. Through the committee, I've been speaking with our environmental services supervisor. It was thought that the study was not. It is something that could be done next year without a risk.
Thank you, Mr. Blackmore. Any follow-up, Councillor Nicholson? Okay. I do certainly recognize the apparent conundrum of saving monies on item 7 and then reallocating monies in item 8. But I'm certainly satisfied if there is not an urgency behind the investigations. Certainly satisfied in the approach recommended herein. Any further questions or comments on item 8? Seeing none, all in favor? That is carried. Thank you. I believe, yeah, that does conclude the Long-Term Care Department report. Could I have a mover on the report as a whole, please? Warden Emo, seconded by Councillor Grills. Further and final opportunity for any question on any of the items in the report. I see none. All in favor? That is carried. Thank you. There is no administration department report at the time of mailing. That continues to be so, Mr. Kelly.
That is true. I'll save my comments for the closed meeting and then coming out of closed.
Thank you. Likewise, we are in receipt of no new Board of Health minutes. Just a reminder to committee, the Board of Health does not sit in July or August, so we will probably pick those up again at our next meeting in October. Any new business? I see none. Closed meeting, as noted at the outset of today's meeting, or just slightly after the outset of today's meeting. We have changed from the time of the mailing of the report, and there is one item for the closed session. I don't know if there is, do we have a resolution? I think I might have the DNP report. Was it part of their agenda that I might read the same resolution, Mr. Kelly?
It is the same resolution, sir. If not, I can read it in there if you do not have it.
Just bear with me one moment, just so that it become part of the minutes. Yeah, and I'm not sure, it doesn't say which part of 239 it is. However, we can include that perhaps in the minutes. I would seek a motion to go into a closed meeting to discuss a proposed or pending acquisition or disposition of land by the municipality or local board with respect to the town of Renfrew. Could I have a mover, please? Councillor Wilmer, seconded by Warden Emo. All in favor? That is carried. We are in closed session. I will provide an opportunity for those Thank you, everyone. We are now returned to open session of the Health Committee. And we just have a final order of business. I should invite, I'm not sure, Councillor Purcell, if you wish to do that at this meeting or if that was something you anticipated at the October meeting of providing notice.
I'm prepared to provide notice currently today.
Sorry, I beg your pardon?
I'm ready to provide notice of motion.
So you would like to make notice today
Yes, I
for
do.
the October Health Committee that you would be bringing forward a resolution?
Yes, so the resolution would be that the Health Committee recommend to the County Council the establishment of a warming center supporting the most vulnerable homeless population, looking at a short-term solution from November 1st of 2023 to the end of April 2024, and working with other stakeholders such as municipalities, service providers, other support organizations to achieve a joint solution.
So procedurally, while I much appreciate you reading that, obviously it had been prepared, the expectation is that motion unto itself would be written, provided to staff that would be distributed with the report for the October meeting. Mr. Kelly, once again, upon your advice, what I would suggest is the minutes of this meeting would reflect that you are providing notice of motion to bring forward a motion that the county participate in the establishment of a
warming center.
A warming center. Okay, and I think that that would be sufficient for the notice, Mr. Kelly. Okay, and the resolution itself, Councillor Purcell, as I said, if you can, and you would have time to review if you wish to amend, revise your own resolution. But Mr. Kelly, when should that be submitted to staff so as to be included in the Health Committee report for October?
10 days prior would be nice, or a week prior is fine, but 10 days. If you've got it in this week, we can.
Certainly.
However you want.
I'll work with Mr. Kelly to wordsmith something that's appropriate. Thank you.
I would suggest no later than say the 1st of October, if you could provide it to Mr. Kelly, and he would distribute it as appropriate.
Thank you for your patience. Appreciate it.
Thank you. So we have received notice. With that, the date of the next meeting shall be Wednesday, October the 11th, 2023. I would now seek a motion to adjourn. Councillor Nicholson, seconded by Councillor Yon. All in favor? That is carried. 10 seconds late.